Questions on that? Not too bad, right? No. It's organized. That's what I'm saying. That's what I like about anemias. They're organized. So you could have anemias due to a decrease in raw materials. You want to make potato chips? If you don't have oil and potatoes, you can't make it. If I need to make a red blood cell, if I don't have iron, I can't make it. Folic acid, vitamin B12, it can't be made, or at least it's going to be deficient in making them. Okay? So let's talk about iron deficiency. Okay? This is the most common nutritional deficiency worldwide. Okay? It is the most common cause in the United States for chronic blood loss. All right, remember we talked about abnormal menstrual bleeding or undetectable GI bleeding, think cancer, if that's what's happening. Also, I want you also to understand that breast milk and cow's milk are low in iron, so they need supplemental. So it's good that you're breastfeeding, let's say 7 months old, but you got to introduce some foods because all the iron is not going to be in the breast. It's one of the few disadvantages on breast milk. Okay, there's so many other advantages with IgA and just bonding with the mom, right? That kind of thing. So there's so many good reasons for that. All right, keep in mind that iron deficiency anemia in a man or in a postmenopausal woman, someone over 50 years old, is GI cancer until proven otherwise. You need to understand that. Okay? Because it's probably going to be this undetectable GI bleeding, which is pretty common. So that's why we do routine screenings of the occult bleeding. In other words, we check the poop to see if there's any microscopic red blood cells that you just don't know about. Okay? We got to fix that. Okay? So hint, hint, do make sure you know that. All right, so diagnostic features. As I told you about, microcytic, meaning very small, and it's also hypochromic, so it's going to be a very pale area in the center. We could do that by looking at the MCV, meaning corpuscle volume, and also the MCHC, okay, so the hemoglobin concentration. Sometimes this is also known as, iron deficiency is known as microcytic hypochromic anemia. Be careful with that too when you take your NCLEX. They might not call it iron deficiency. They may call it this instead. Okay? So the red blood cells appear small and pale. You're going to have a decrease of ferritin. As I said before, ferritin inside the bone marrow is going to go down. This is what the storage sites of iron is inside the bone marrow. Okay? So keep in mind, for anemia of chronic disease, it will go up. Because it's not that you're losing red blood cells. Does that make sense? It's just that there's something wrong with the transportation of the iron. You're going to have either normal or decreased transferrin, those little protein buses that are carrying the iron. And because if there is transferrin that's going on these buses, you're going to have a lot of empty seats on there. So therefore, you're going to increase your total iron binding capacity. There's a lot more seats that's able to put more iron into your buses because there isn't much iron here, right? So that's what it looks like, iron deficiency. This is what it looks like normally, so that you can see the difference over here. All right? Microcytic hypochromic anemia. All right? Symptoms, you get all the traditional, or classic, I don't want to say traditional, but classical things for just anemia. You get fatigue, SOB, that's not me, SOB, short of breath. Okay, you're going to see that often too. So fatigue, short of breath, weakness, dizziness, pale, those are all the classic things that you would see in normal anemia. You also get these spoon-shaped fingernails, and I'll show you what that looks like. All right. Also, it's common, but not everybody has it, this thing called pica. Pica is, you eat these substances that really are largely don't have any kind of nutritional value. And the one that we see quite often with iron deficiency is they tend to eat a lot of ice. Right? That's not anything that's like bad for them, but it's kind of like you haven't eaten, for the past 3 months you've been eating a lot of ice. I don't know, I just like the crunch on it. Okay, I'm not saying it is that, but it could be, I don't know, something. We call it pagophagia. But pica, as you mentioned, we see pike in other things too, sometimes in pregnancy. They eat things that are very odd. And the common ones I see is dirt, sticks, stones, like little pebbles. Anyway, that's what that is. Treatment for this, for iron deficiency, is find and treat the underlying cause. Keep in mind what I always said is anemia, think of it as a symptom or a sign, not as a disease. Although it is a disease, but there's a reason why, right? They give them iron supplements, and vitamin C enhances intestinal absorption of iron. Ooh, how can you use this? This is where you as a nurse can help things, right? Patient education. When they take your iron tablets, take them with orange juice. Broccoli. Yeah, broccoli, there's a lot of iron in there.
Yeah, that's what my doctor said.
Yeah,
He said when you
spinach.
drink it with orange juice.
Yeah, iron, I think liver too. Liver worse. Yeah. Okay? So this is what the nails kind of look like. Right? See how like it's spooning like that? The spoon shape? That's why when I go to the cashier in Walmart or whatever, I look at their hands. I can't help to. I'm like, oh, I know what you got. You know, I know what you got. I know what you got. I know what you got. No, I don't ask that. I don't ask that. It's just, but I have an idea what's going on. You know what I'm saying? That's why you got to be keen, and you will when you get into the medical field. You'll be keen about certain things. What's that?
Is it the clubbing?
No, that's not clubbing. We'll talk about clubbing. Clubbing goes out. That's just the opposite. It kind of dips in.
It dips in.
See how it like dips in? Yeah. That's what I mean. Look at your friends and look at your parents and grandparents, and you start looking at that. They don't realize that, right? So when someone's, you know, like I said, if you've got iron deficiency, you've got this undetectable iron that's going out your poop, this may be the first sign you're going to see. Because you're not seeing that through the poop, right? All right. All right, megaloblastic anemia. This is when we have anemia due to a decrease in vitamin B12 and or folic acid, right? So we need these things for DNA synthesis, okay? And what happens here, if you don't have it, then you're not going to have the DNA synthesis in the red blood cells, especially. So the bone marrow cells make red blood cells with shortened lifespans. So instead of 120 days, now they only last for 50 days, okay? Inadequate diet. If you see this often with that, that's probably the more common reason. But I think it's even more common with intestinal malabsorption. People who have celiac sprue, okay? Not expecting you to know that now when we get to the GI. In people who have celiac sprue, you have, on the intestines, you have all these villi out there, right? That's what normally happens, and then you have absorption happening on all these fingers. Well, in people with celiac sprue, it's like this. So they don't have the villi, it's flat. So the absorption is not going to happen. So there's, like I said, if you have, let's say, this, megaloblastic anemia, think of that as a sign that there's some other cause. They really have celiac sprue. See what I mean? That's what I want you. Or they got a tapeworm. Tapeworms will stick onto certain tapeworms will stick onto your intestines, and any vitamin B12 that's going in there, they grab it before you grab it. So it's that. All right? Diagnostic features is that they get macrocytic, so their MCV is increased, and hyperchromic. So in other words, they're big, and you can't see that pallor that's in there, right? That white space in the center there. They kind of look like this. So that's what normal looks like. Here's someone like this. Kind of similar to spherocytosis. Okay? But that's what that looks like. All right? Now, diet. We see vitamin B12 is found in meats, but it's also found in dairy products and eggs. Okay? So if you're a vegetarian, you're not eating meat, you're still getting vitamin B12 because you're getting it from the dairy products. The ones that we got to be concerned about are the vegans. And a vegan is not eating any meats or any byproducts of animals, meaning eggs, milk, and so forth. Now, luckily, that vitamin B12 stays in our liver for anywhere from 1 to 2 years. So you're not going to see much symptoms happening with this until about 1 or 2 years later. Easy fix. They could do their vegan diet, that's no problem, but you got to take vitamin B12 by the mouth. Okay? And that's what happens with this. Now remember, vitamin B12 also has neural deficits also. So you got to put that all together from when we talked about the nervous system. So put that in. So when you see someone who has neural deficits and you have megaloblastic anemia, you're putting it all together. You know what's happening there, okay? Now, I do want to mention about pernicious anemia, okay? This is an autoimmune disease. Now, we got to go back to A and P2 and understand that in order for us to go into the GI tract, for us to understand that when you take vitamin B12 through the mouth, it'll go right through your intestines and go out your, well, it goes out your pee, okay, because it's water soluble. For it to get absorbed into your intestines, it needs help. And there's something that comes out of the stomach called intrinsic factor. Intrinsic factor comes out of the stomach, is going to bind to vitamin B12 from your diet, and now this complex can get absorbed into your bloodstream. But if you don't have that intrinsic factor, then that vitamin B12 is going to go out your urine. It's not going to get absorbed. We call that pernicious anemia. And what happens here is that this is an autoimmune disease that will actually attack and destroy the parietal cells that make the intrinsic factor in your stomach. Okay? Does that make sense? So you need that to happen over here. So in these people, it's an easy fix. We just have to give them intramuscularly vitamin B12. This one only needs to get by mouth vitamin B12, but these need intramuscularly vitamin B12. Now, why do they need intramuscularly, and why can they take that by mouth? Right, and over here? Right, okay, so let me reiterate it. In these problems, there's no problem with their intrinsic factor. They're just not getting it in their diet, the vitamin B12. So when they get the pill is actually going to bind with intrinsic factor and get absorbed into the intestine. In these people, they don't have the intrinsic factor. So therefore, the only way they can get it is not by mouth, because it's going out your pee, the vitamin B12. So they give themselves a shot in their muscle, and that gets absorbed into the bloodstream that way. Okay? So let me ask you this. So you can put these things together. If someone has a gastrectomy, someone who has their stomach removed for stomach cancer, whatever, why would they become anemic?
They have the lack of intrinsic factor.
They can't make intrinsic factor, right? They don't have the parietal cells. If someone's got kidney disease, why would they be anemic? Right, your kidneys don't work. What does a kidney secrete to make red blood cells go up? Erythropoietin. So if you have kidney disease, you're not going to make erythropoietin. It means your red blood cells are not going to go up. If you don't have your stomach, you're not going to make intrinsic factor. You're going to have some sort of anemia. What if it, and let's go a step further. What if someone has liver disease? Why do they cut themselves and they keep on bleeding? They don't clot.
The liver makes all the clotting.
Right, the liver makes all. You see, those are questions that I would ask on a final exam. The big picture of what's going on here. That if you have a patient with cirrhosis of the liver and they fall down, why do you need to run over there and worry about bleeding? If someone has kidney disease, what do you have to give so that they don't become anemic? See what I'm saying? That I want you to see the big picture, not the little trees for the final exam. I need you to see the big picture so that you could carry this information and understand it. You might forget about a disease or two, but the mechanism you will remember. But the names, you just have to go through. I want you to see the trees for each one of these little exams and quizzes. But for the final exam, you got to look at the whole forest. That if you understand what anemia is all about, there's 3 different ways, then you can put this all together. That's what I need you to do, to get into. Does that make sense? Okay? All right. So we okay with this intrinsic factor? Good. All right? All right. So red blood cell disorders. Now we're just going to talk about if there's an increase. I only got one slide of this. Polycythemia. Okay? We kind of talked about it already. So if you have too much red blood cells, we also refer to this as erythrocytosis. Now, keep in mind about these suffixes. Cytosis means an increased amount. Penia is a decreased amount, right? Thrombocytopenia, right? Neutropenia. These are decreased amounts, okay? Thrombocytosis, an increased amount of platelets. So you should be putting these things together, and I don't need to spell out all this. You should start saying, well, I'm seeing cytosis quite often. It's always an increase. You got to, it's another language, right? Okay, so you have an excess amount of red blood cells, all right? The causes of these, well, you could have, the most common cause, at least we're seeing in America, is dehydration. So what's happening here, it's a relative polycythemia. It's not really, I mean, it's polycythemia, but it's not going to be effective, all right? It's not going to be functional. What I'm saying here is dehydration. If you have, let's go back to that lemonade, right? You got the crystals and you got the water. But if you're dehydrated, the water is the only thing that's coming out, leaving the crystals there. So when you taste it, is it going to be very bitter or is it going to be diluted? It's going to be very bitter. It's going to be highly concentrated. So when you start looking at the amount of red blood cells or crystals with the water, then it's going to look like there's a lot of red blood cells there. We call that relative polycythemia. Does that make sense? If you put the water back in them, then it'll be fine. So it's just, it just looks that way, okay? Hypoxia, that's what we talked about before, right? So if you have, let's say, you move to a higher altitude, from sea level, then there's going to be less oxygen out there in the atmosphere. So that less oxygen is going to go into your system, but your body is going to respond to that low oxygen, hypoxia, and it's going to tell the kidneys to secrete erythropoietin to make more red blood cells. So now you're going to have polycythemia because it's trying to adapt to that new climate, not climate, but that new altitude. Okay, so you originally had good amount of red blood cells, but now you're moving up there and there's less oxygen, so it's kind of doing that. Okay, so it's secondary to that atmosphere. If you have some kind of chronic lung disease like emphysema or COPD, which we'll talk about another time, then that's going to also increase your erythropoietin. Okay, does that make sense? You could also have polycythemia vera, and what that means is that's a primary source of causing of this polycythemia. All right, so it's usually some kind of bone marrow malignancy. Something in the bone marrow is cancerous. So it's going to produce a lot of red blood cells. So it's going right to the source of the factories. Primary source, primary polycythemia. This is secondary. Does that make sense? Because high altitudes is going to tell your kidneys to produce erythropoietin. It's going to increase the red blood cells. So that's secondary, the secondary polycythemia. So the difference between primary versus secondary, right? And then you got this relative polycythemia also. All right. Now, what's going to happen is, as I explained to you, if you increase the amount of red blood cells in your blood volume, the blood in your, or the red blood cells are going to get more condensed. The blood is going to get thicker. It's going to press more on the blood vessels themselves, the walls of the blood pressure, and increase resistance. So now the blood is going to move slower. And if it moves slower and the blood is thicker and an increase in resistance, that's going to increase your blood pressure and you will have severe hypertensive crisis. Okay? That's what's happening with this. Okay? Red blood cells get condensed. And then there's something called blood doping. You guys heard about this? All right? I'll talk more about this when we get to respiratory, but just a little brief understanding about what it is if someone is running a marathon down on sea level, but they want a big boost of oxygen. So what they do is they train themselves in the high Alps of, let's say, or not the Alps, let's say Rocky Mountains. So you're now at a higher level. Your body's going to produce more red blood cells because of that whole mechanism. Now they're going to take some of that blood out of them, a pint of blood or whatever, and going to keep it in the refrigerator. And now they're going to move back down to sea level, and they're going to pump that blood back into them, like a week later or whenever the marathon is. So technically, it's their own blood, but they're pumping in more red blood cells, and that's going to cause polycythemia and cause high blood pressure. Does that make sense? They do this for the extra pump blood, but it's bad because, what's that?
Is that allowed, or is that?
Some places allow it because it's not a drug, it's your own blood. Other places say no. The bigger problem is when we deal with horse racing, because that's a big issue because we're talking about winning hundreds of thousands of dollars. So some states allow it and some states don't. Some states actually allow you to inject something that's going to stimulate erythropoietin in the horses. And that's going to make them more. What that is that, I wouldn't say it's cruel, but what I'm saying is it's actually going to cause hypertensive crisis if not done correctly.